The Southern California Orthopedic Institute presents A Patient's Guide to Partial Knee Replacement. Can you recall a time when you could enjoy your favorite leisure activities without pain? Even the slightest effort can become a bad experience with a problem knee. What causes knee pain and what can be done about it? The knee is a complex mechanism. The bones that make up the knee, the femur and the tibia, meet to form a hinge joint. The joint is cushioned by articular cartilage that covers the ends of the tibia and femur. The lateral meniscus and medial meniscus are pads of cartilage that further cushion the joint, acting as shock absorbers between the bones. Ligaments help to stabilize the knee. The medial collateral and lateral collateral ligaments run along the sides of the knee and help limit sideways motion. The anterior cruciate ligament, or ACL, connect the tibia to the femur at the center of the knee. Its function is to limit rotation and forward motion of the tibia. Likewise, the PCL, or posterior cruciate ligament, located just behind the ACL, limits backwards motion of the tibia. The interior lining of the knee joint is the synovium, which secretes fluid to lubricate and nourish the joint. The knee is protected in front by the kneecap or patella. The patella tendon attaches the patella to the tibia and keeps it aligned in the femoral groove as the knee bends. These components of your knee, along with the muscles of your leg, work together to manage the stresses your knee receives throughout the day. The pain that you are experiencing in your knee is most likely a result of osteoarthritis. Osteoarthritis causes the normally smooth sliding bone surfaces to become pitted and irregular, and abnormal bone spurs to develop around the bone's outer edges. Degeneration may advance to expose raw bone, leaving pieces of broken cartilage to float within the joint, producing symptoms of pain, inflammation, and stiffness.
Okay, what we'd like to do is go over some concepts involving partial knee replacement compared to a total knee replacement. We're going to start out by going over the concept that in a total knee, all the compartments of your knee are arthritic and have damage. So the medial, the lateral, and the kneecap are all damaged. So we look at these x-rays here on the screen, you can see that this represents a total knee replacement. All the knee is gone, and the treatment for this is a total knee replacement, as you see on these x-rays here. If you're lucky and you only have part of your knee with a lot of arthritis, as you can see on this x-ray here, this is predominantly medial, on the inside of your knee, 90% are medial, then you can have a partial knee replacement. And these x-rays show you the pre-op of the compartment arthritis and then going into the uni-compartment replacement. So let's just play with this and see what this looks like technically. Okay, so what we're showing here on this sawbones, this is the medial compartment, this is the lateral compartment, and the kneecap has been taken off. So what this represents is the partial knee replacement. So here's the femoral component on the femur, then there's metal here, and then there's plastic right here. So this is what you see. This is a partial knee replacement, medial compartment. There's lateral, and that's how it moves. So that, as you can see, the morbidity is much less than for a full knee replacement.
Because of the extent of this type of surgery, you must be medically cleared by an internal medicine physician. This physical exam will include a chest x-ray, EKG, and blood test. 1 week before your surgery, you will return to the office for your pre-operative appointment. At this time, your surgery assistant will review general instructions and questions that you may have and give you a small supply kit. A long leg x-ray will be taken so that the doctor can plan ahead for your surgery. Pre-admission is then completed at the hospital, including final paperwork and a blood test. On the day of surgery, you should arrive at the hospital admitting area 2 hours before your surgery time. There you will meet with your anesthesiologist to discuss options available to you during surgery. General anesthesia is routinely used for this type of surgery. This puts you completely asleep. The entire surgical process takes about an hour and a half. That same day, a physical therapist will start working with you. Your activities will include walking with a walker and leg brace, and strengthening exercises. The usual stay in the hospital is 1 to 2 days. The CPM machine and cold therapy unit will be delivered to your home, and a physical therapist will visit 3 times a week to continue to assist you in your exercise regime. 3 weeks after you are discharged from the hospital, you will return to our office for your first post-operative visit. X-rays will be taken, your dressing will be changed, and your overall progress will be evaluated by your doctor. As with any surgery, there are possibilities for complication. These include nerve damage, vascular injury, anesthesia complication, pain, loosening of prosthesis, and infection. While infection rate is very low, approximately 1%, this is the complication of most concern. Should an infection occur, additional treatment will be necessary. This may consist of antibiotic therapy and irrigation and debridement of the knee. Overall results for this procedure are excellent. In the 10 years of follow-up studies, 85 to 90% of all patients are happily functional. Although every case differs, complete recovery from a partial knee replacement procedure takes approximately 2 to 3 months. With a little patience and a little work, you will be back to your favorite leisure activities in no time.
The differences between a total knee replacement and a compartment in the total knee replacement: you're in the hospital 4 to 7 days. You usually have to donate 2 units of blood. Skin incision is about 9 inches long, and you require general anesthesia, and we usually use an epidural for 2 days, and then IV pain medicine afterwards for pain control. In a partial knee replacement, you're in the hospital 1 or 2 days. Most of the people go home the next day, some go home the day after. We don't use an epidural anesthesia, we don't use IV anesthesia because you don't require it. The skin incision is less than half, it's about 4 inches long, and there's no blood donation required. Now, total knee replacement is an established procedure. They have articles in the literature that are 20 years long, and in some of those articles, 90% are still functional. In the uni compartment replacement, or the partial replacement that we just demonstrated, most of the results are 10 years. The prosthesis that we currently use, they've had a number of series that are 10 years, and 90% are still functional. But we don't have 20 years, so we don't know if the compartment will last as long as a total knee replacement. If partial knee replacement fails, then it can fail because it loosens, the cement doesn't hold it. The other compartments, the lateral or the patellofemoral compartment, can become arthritic, so you have to convert it to a total knee replacement, and that's basically what you do. It's not that difficult to convert a partial to a total. So the advantages for the partial knee replacement are that it's a much smaller incision, there's significantly less pain right around the operation and in the recovery period. You walk on it right away, and you get more normal motion. Get close to what you came in with or even more, and it feels more like a normal knee. Okay? And if you have any questions, we'll be happy to talk about that. Thanks very much.